Hi there. Hope you're doing okay. Good afternoon, good evening, and good morning, wherever you're watching me from. This is Dinte Clivet Alonfi, also known as the African pharmacist. And today I will be talking on something not new, something we already know, something that is really, really troubling the entire globe. And this thing is, I title it the dark invader because it happens when you least expect. It occurs when you don't even think something is happening. And before you know, boom, it is there, taking a really, really fast one on you and the family at large. So, what am I here to talk on? I'm going to talk on cancer in commemoration of World Cancer Day that took place on the 4th of February 2024. And in this effect, I will first of all start by telling us what cancer is. We cannot assume we know. And when I say cancer, I'm talking about a fundamental disease that occurs due to an abnormal division of cells in the body. And when cells in the body divide abnormally, they turn to be a real problem. And when we are looking at cancer, we must mention genes. And when we're talking about genes, there are two types of genes highly involved in this particular activity that we must talk on. We must talk on the oncogenes, which are genes responsible for cell growth and reproduction. And we have the tumor suppressor genes, which are genes responsible for regulating cell division and survival. Now, for malignant transformation to occur, and when I say malignant transformation, I mean for a cancerous cell to develop, what needs to happen is that there are either three possibilities. There are three possibilities. Either we have the first possibility being there is an overexpression of these oncogenes, or there is an under expression of these oncogenes, or the third option being there is a disabling of the tumor suppressor genes. These tumor suppressor genes are there to regulate cell division and survival. So this, if there is a disabling of such a gene, then it might lead to anarchical, uncontrollable cell growth or cell division. And now, how will you know that you're affected with cancer? The amazing thing, or the unfortunate thing rather, is that with a cancerous cell, or with cancer generally, you cannot tell when you're suffering from it just like that, because most often in the primary stage or in the preliminary stages of the disease, you no symptoms are visible. You don't feel any symptoms. You might just feel some general body malaise and all the like, and there is no direct pinpointing to the disease itself. And it is easy for people who constantly go for screening, people who constantly do checkup, to identify if they are having such a disease at an early stage that is treatable. But people who rarely go for checkups, and it becomes even difficult. And even when they organize free campaigns for these people to go and do their checkup, still they do not go. So they expose themselves more and more to the difficulties and the disabling or the disheartening effects of this dark invader, which is the cancerous cell. Now, how do we even know? Generally, a cancerous cell, when growing, that is a malignant cell, you easily feel discomfort around the area where it is growing. And when we say feel discomfort, for instance, if it is around the breast area, you could feel a lump or a mass in your breast. A mass in your breast. It is if it is around the scrotum, or the testicles, you feel a mass around that area. And for people with, if it is for those who suffer around the bowel, you will feel difficulties or changes in bowel movement. And when for people with lung cancer and all the like, if you may want to know, people with lung cancer, they will easily difficulties in this because the mass has blocked some of these vital tubes through which air passes to or through which gaseous exchange takes place. And because of this, it becomes a really challenging and devastating situation. Now, different types of cancer occur in different parts of the body. Sorry, in different parts of the body, they have different names. In the lungs, they'll call it lung cancer. In the breast, they'll call it breast cancer. In the testes, they'll call it testicular cancer. In the prostate, they call it the prostate cancer. And in the ovary, they'll call it ovarian cancer or uterine cancer, depending on where it is located. And when we look at cancer generally, it is thing we can prevent. Yeah, cancer is something we can prevent. Most cancerous cases or most cases of cancer death are things we can prevent, ranging from our daily lifestyle is something if we can modify it to live a healthier and a better life, we will be able to live longer and free. Lifestyle modification, what do I mean? For instance, people who constantly smoke tobacco or cigarette, people who are constantly smoking whatsoever, people who are like this weight gain stuff, and people who are obese are at an increased risk of developing a cancerous cell. We move forward to people who do little or no physical activity, equally at an increased risk of developing cancer. And we equally have this group of people who, sexually transmitted disease, people who engage in unprotected sexual intercourse, and they are constantly being exposed to sexually transmitted infections of developing a cancer. Yeah, we can avoid them, ranging from don't smoke. Alcohol consumption too is another risk factor for developing cancer. Now, not to smoke, most often they will look at us as if we hate them. When we tell people not to drink alcohol, sometimes the quantity of alcohol they take at a time, they will think we want to kill them. Some people are that into alcohol that they do not even value their own life. Another category of people are those who will say they cannot do physical activity. You have them to do sports. They should just exercise for a while. They say they cannot exercise. The vehicle to their house, to school, and everything is vehicle, a car here and there. Those category of people, they are more prone to different types of diseases. And I remember how I used to look at when I was growing up, I looked at people who, especially fathers, fathers who were riding bicycle. Yeah, for those who know bicycles, father who were riding bicycles. I look at them as if, when I say fathers, I don't mean Catholic priests. Sorry, I mean we looked at they were the most physically fit of all the categories of parents. Those who engage in farming, in physical activities, they were physically fit as compared to those who were looking healthy and chubby with a large stomach and everything. So at the end of the day, it is only when I got into this field, I got into the realization that those category of people are healthier than this other category of people I admired before. The people who just are bulky, healthier with a big stomach and all of that. But now I've gotten to realize that those people were fit and those people lived longer as compared to the people who did little or no physical activity. And when you look at it generally, most people who live longer on earth are people who are not too fat. Yeah, people who are not too fat, who are not obese. Obesity comes with a lot of trouble. Obesity, overweight comes with a lot of trouble. So generally, people tend to regulate their weight because they want to stay fit. They want to avoid other diseases. And ladies and gentlemen, so many things are happening at a level we can prevent. Sorry, and if you look at even the sexually transmitted diseases, there are a lot of condoms out there, but people say they cannot use condoms. Some people will go as far as say the sex is not sweet when there is condom. So they prefer to go wrong. Yeah, the euphoria of the moment is there. Matter syphilis, herpes simplex, and every other thing that is affecting you, that will affect you sexually. And now the funniest thing is that most of these people do not have one sexual partner. They move and then they spread it from person to person to person, and it becomes a real challenge, a big burden. And where are we headed to? Where are we really headed to? So at the end of the day, we can prevent some of these things. Now, coming to treatment, well, before treatment, probably diagnosis, because if they don't diagnose it, they will not know how to treat it. And coming to diagnosis, most often you need to do a series of tests. Maybe you have been feeling one general body malaise, you've been feeling somehow, you've just been feeling sick. You have this general perception of feeling sick, but you go to the hospital every now and then, they cannot exactly tell you what is wrong with you. So at this point in time, they want to probe further, they keep probing, they keep going. They discover maybe they cannot be very definitive at the first stage. So if they discover that something like that is a possibility, they can send you for an X-ray, send you for more blood tests. They can send you for an endoscopy, for tissue biopsy, and all the like, just to be very sure which type of cancer you are suffering from and what stage of this cancer is already affecting you. And in Africa and Cameroon, where we are, it's a little bit disheartening to know that most of such diagnostic tools to determine or to detect this dark invader early are not available. Well, partly because of the facilities in the hospital, and partly because of the nonchalant behavior from the patients and the community members. Because most of the time, campaigns are held every now and then to educate people on these things, but who will turn up? They claim dizzy for their own health. They tend to purchase or pursue things that they value at that time, neglecting their own health. So at one point in time, it's a two-way thing. We cannot completely blame the healthcare system. We equally blame the members of the public for neglecting their own health. So these serves as a clarion call to everybody, a clarion call to everybody who will hear this video or who will see this video and listen to my voice. Please, ladies and gentlemen, go for your screening. Go for your screening. Just go for checkup. You might not know what you are suffering from. Just go for medical checkup. Go and do that scan. Go and take that test. Just do it. Just do a checkup. Visit your doctor. Just discuss. Visit your health practitioner, health professional. Just visit, discuss with them. They will better guide you. They will better show you the way. So, ladies and gentlemen, these things are preventable. We can prevent a whole host of these diseases, except for those that are genetic in nature. Those that are genetic in nature, they are not preventable. But a whole host of these diseases or this particular dark invader cancer is preventable. Let us take the measures right now. And when we are looking at it, yeah, if you cannot prevent it, and maybe you have already contacted you're already sick with this dark invader, that is cancer, what should you do? There are a whole host of things you can do. There are a whole host of medications you can take as a category of chemotherapy, but you must be ready for the side effects of these drugs. Yeah, in all honesty, chemotherapy is not a good thing. I personally do not advise anybody to go in for chemotherapy because chemotherapy, what I have witnessed with chemotherapy, is it was never a good idea. And first thing first, your health falls off. Alopecia. A patient leaves the chemotherapy room worse than she entered. No. That's not how treatment is supposed to be. So, ladies and gentlemen, chemotherapy is an option, but you shouldn't wait until you reach that level. Radiotherapy is another one where they use radiations and try to see how they can bombard and destroy these cancerous cells in your body. There's another one, but what you must know is that all these things come with a lot of side effects, a lot of consequences you have to deal with. So at the end, my friends, prevention is still better than cure. There are a lot we can prevent. There are so many things we can do. And you joining us just right now, please, you can always share this video to your loved ones. Share so they can see and hear a lot about this cancer. There is a lot to say about cancer, but let us stay around prevention. Preventing it, knowing how what we eat and what we drink is very important. Alcohol consumption generally is not good. Yeah, it's not good. But having the understanding that there are people who cannot go without alcohol, we will always advise you reduce to the bare minimum. You reduce your alcoholic consumption to the barest minimum, and then you practice safe sex. Please practice safe sex. Engage in physical activities to keep fit, to burn that calories and all the like and all the like. There are a lot of things. Eat a healthy diet. Yes, that is something. Eat a healthy diet and change your mentality. Eat a healthy diet. And simply because you're diagnosed with cancer doesn't mean that is the end of the world. Yeah, one thing I've understood with people who are sick with cancer is that most of these people generally, the when they don't know they are sick with cancer, they are healthier than when they know. That is post-diagnostic depression sets in, and because of that, a lot of negativity start coming into their mind. They start have there is this pitying, self-pitying, and they start playing the victims and all the like. These negative influences, negative effects, negative perception of self begins to weigh down on them. And once it begins to weigh down on them, it causes them to feel really unwanted. And this alone is enough to damage that person, is enough to cause the untimely death of that person. My friend, if you're listening to me right today and anytime you hear me, just know that cancer is not the end of the world. Yes, cancer is not the end of the world. And I have this amazing story that I must share with you. There is an American singer by the name, she goes by the name Nightbird, but and she was suffering with different types of cancer. And she sang one amazing song in American Got Talent titled "It's Okay." So you can just go type American Got Talent Nightbird, or American Got Talent is okay by Nightbird. You will see that song. That lady was suffering from is it fourth stage cancer? I think it was a lung cancer, three different types of cancers combined. But she still came out in the midst of a multitude of people to sing an original song titled "It's Okay," where she was trying to express her life, how she's been able to live with the fact that she has cancer. And she said something that really caught my attention. You mustn't wait until everything is all right before you decide to be happy. You mustn't wait for everything to be all right before you decide to be happy. Now is the time for you to be happy. Whether you're having cancer or not, this is the time for you to be happy. Go out there, my friends, and be happy. Do the things that make you you. Do the things that make you feel alive. Do the things that inspire others. People are yearning to hear your voice. No, don't go because of a disease. hide in that cocoon and think that it is the end of the world. No, you were brought out here for so many things. You can always defeat infections. A positive mindset is all you need as of now, and start taking your, provided there is the appropriate treatment, start taking it. Sometimes alternative treatment too is advised at times, alternative treatment. And gentlemen, I've said a lot today about cancer and its prevention, news of how to prevent cancer. Your environment too is very, very important. Your perception of the disease is an important factor. So go out there and spread this good pharmacist. And he is a lecturer of his nation. And whenever you see this video, please don't forget to like and share. Don't forget to like, subscribe, turn on the notification bell so that each. Thank you, and I love you all.